So today we're talking about crisis fatigue and what to do about it. And this week in May is Mental Health Awareness Week, which is organized and endorsed by the Canadian Mental Health Association. And this month, we are putting on free webinars every Thursday to get real about the topic of mental health. So we've seen a decline in mental health globally over the course of the pandemic. And we'll be talking about topics to help you recognize and manage your mental health. My name is Nicolette Gowan. I'm an occupational therapist at Gowan Consulting. Gowan Consulting is an organization of occupational therapists across Canada that provide support to employees and employers by collaborating on sustainable solutions for staying at work or returning to work. As an occupational therapist, I work with employees with a variety of physical, cognitive, and emotional limitations that impact their ability to engage with work. I frequently use principles of cognitive behavioral therapy, mindfulness, and self-compassion when coaching individuals to best manage their mental and physical health. For those of you who joined us for the accommodation conversations, you'll see some similarity in some of the information that we discussed about mental health. But we will expand on this idea of crisis fatigue, provide some strategies to maintain well-being, and also some crisis resources. So a bit of an agenda of today, we'll talk about what is crisis fatigue. We'll talk about the mental health continuum, the importance of self-awareness as the first step to managing mental health, and talking a little bit about self-care and crisis resources. What is crisis fatigue? Crisis fatigue is a term to describe the emotional and physical burnout response to chronic stress that can be caused by challenging events or crises. Crisis fatigue is not an official medical diagnosis, but it's a term used to describe the overwhelm of stress and difficult emotions that occur during or after a crisis. When we are stressed, our bodies and mind go into the fight, flight, or freeze response as an automatic activation of our sympathetic nervous system. And this can impact our physical body, our mind, emotions, and behaviors. And excess levels of these stress hormones and this response can cause us to burn out, to feel perpetually fatigued, depressed, anxious, forgetful, easily angered, and potentially turning to unhealthy methods of coping, such as drugs, emotional eating, or alcohol. When we look at the Yerkes-Dodson stress and burnout curve, we see that there is an optimal amount of stress that we need to motivate us, drive us to reach our goals, and overall just to keep us moving. However, when the stress response is constantly activated without ways to calm the nervous system or to manage stress in productive ways, we can reach this point of emotional and physical burnout. Our body and mind can no longer handle the amount of stress and the stress hormones, so we can get to this point of feeling anxiety and complete meltdown, eventually feeling this hopeless and helpless feeling. When we look at this pandemic, you may have noticed different points where the stress that we've been under has been able to drive you to new learning, growth, forcing you to adopt new resiliency activities or change your way of doing things in a positive direction. But as we go in and out of lockdown, and as restrictions change, as the activities that we're able to do change, the stress continues to build. And a large percentage of a population can reach this point where it's no longer pushing us forward, but it's burning us out. This is crisis fatigue. This is emotional overwhelm. And this is why we see large increases in anxiety, depression, and substance use across the population. Who gets crisis fatigue? Who is most susceptible? When we look at the COVID-19 pandemic, our frontline, essential, and healthcare workers can be considered high-risk populations for crisis fatigue. So these are the workers that do not have options or for working from home, and they face this exposure and this fear to the virus on a consistent basis. Our healthcare workers are managing very high numbers and low resources to support the increase in hospitalizations. There is no wonder that their stress response would be constantly on high alert. But this is not to say that these are the only populations that can experience crisis fatigue. In fact, anybody can experience crisis fatigue. Everyone around the world is experiencing an overwhelm of difficult emotions resulting from worrying or caring about loved ones, about our own physical health and safety, lack of control or predictability around restrictions or what we can do to prevent the spread of the virus. And it's fair to say that this stress response is high in many people and has been for over a year now. Each new rise in cases and subsequent lockdown or restrictions can further contribute to that. Let's take a look at some of the symptoms of crisis fatigue, this burnout response to stress. You may notice feeling anxious or helpless about the current situation, maybe getting to a point where you're lacking empathy for others, having unexplained body aches or pains, maybe using more alcohol, drugs, or cigarettes more frequently, becoming withdrawn or this feeling of wanting to isolate from others, having difficulty returning or being at work or school, difficulty concentrating. And these symptoms can last for weeks or months, and they may be worse if the crisis seems or feels indefinite. Let's take a look at the mental health continuum. So it's important to know that mental health is not just about being mentally healthy or being mentally ill. We see that we are all somewhere on this continuum. Sometimes we may feel that we're in this green, healthy zone where we're calm and we have normal mood fluctuations and we're performing well. But then maybe we are getting some stress and maybe we move into this yellow reacting phase, and maybe we have nervousness or we're feeling sad more often, we're forgetting things or having trouble sleeping. I'm sure this sounds familiar to most people. But if this stress continues to build up and we're not paying attention to it, it's possible that we can move into this orange or injured zone where we're angry, we're feeling anxiety, we're feeling negative towards things, maybe our outlook or our mindset is always kind of negative. Maybe we have restless or disturbed sleep. And again, if we're not careful and we're not monitoring, we can move into this stage of being ill, where we really need help and care to get ourselves back to healthy. And so maybe we feel like we're having more angry outbursts, or we are depressed or having suicidal thoughts. Maybe we just can't sleep or we sleep all the time. So 5 out of 5 of us are all on this continuum every single day. We are somewhere along this. And the importance of this mental health continuum model is to know that it starts with self-awareness, being aware of what stress feels like for you, what maybe triggers that stress, and then having some tools and strategies to help get you back to a healthy, into that green zone. And maybe sometimes you need additional help to get there. Now let's take a look at some of the mental health statistics that have been measured throughout the pandemic. Looking at the pandemic, we can see indications that women are disproportionately impacted by feelings of loneliness. Impacts of childcare and domestic requirements can lead to job reduction or sadly, job loss. Studies in 2020 show that women experience higher reported rates of anxiety, which may be due to more a difference in self-reporting and a stigma associated with men reporting anxiety. But the results indicated 24% of women versus 18% of men. Loneliness for women was reported around 23% and 17% for men. The impact of job loss on customer-facing, non-essential businesses such as retail and food services means an overall loss in meaningful activity, contribution, and routine, as there's few options for them to stay at or return to work. We also have increased stress and burnout, as noted, seen in the healthcare and other essential workers that are working tirelessly, facing exposure and stress with the second and, in Ontario, now third lockdown and third wave of this pandemic. And with this third variant being even more unpredictable and harder to control, we could expect that the stress levels only continue to rise for these essential workers. An article in 2020 in the Toronto Star posted results from surveys that looked at the mental health of workers over the course of the pandemic. And seeing as this was reviewed at the end of 2020, expectedly, these statistics would show a further decline in mental health as we surpass a year in the pandemic and enter this third wave and lockdown in Ontario. A survey by Morneau-Chappelle indicated a 3.5% reduction in overall mental health and well-being in November 2020 from the beginning of the pandemic. Mental Health Research Canada looked at the rates of depression and anxiety from the beginning of the pandemic to October 2020, reported rates of depression increasing from 4% pre-pandemic to 12% in October 2020. Again, rates would likely be higher if respondents completed this survey today in 2020 or 2021. The same survey reported rates of anxiety to raise from 5% pre-pandemic to 20% in October 2020. Another consideration from this pandemic is the increase in the amount of substance use, likely as a means to cope or out of loss for other valued activities. In November 2020, CAMH reported that 25% of polled individuals reported binge drinking in the previous week, which can make mental health concerns pervasive or contribute to dependency or unhealthy coping strategies. Likewise, reported use of cannabis has increased over the course of the pandemic. So it's clear that we have a population of individuals and employees that are struggling, and self-medication seems to be a common way to manage the worry and stress of this pandemic. We also know that as employees work from home, they have more of an opportunity to engage in these unhealthy coping strategies, which can pose a risk to health and safety of the employees and their organizations. So there were similar surveys on the mental health of Ontarians that showed a dramatic decrease since previous polls over last summer. The Canadian Mental Health Association reports the following statistics. 36% of Ontarians say they're experiencing very high or high stress. 35% are feeling very high or high anxiety. 17% say that they're always or very often depressed. More than 1/4 of Ontarians, 27%, are using more substances to cope. Nearly 8 in 10 Ontarians can see how COVID-19 is negatively impacting the mental health of others. Further to these statistics, recent data from Morneau-Chappelle shows that Canadian managers are experiencing greater levels of mental distress than non-managers as a result of the extraordinary changes to the workplace throughout the pandemic. In March, the research found that managers have lower mental health scores when compared to non-managers, with the group 50% more likely than non-managers to report a negative impact of the pandemic to their mental health. Just with employees, managers are experiencing their own overwhelming stress and emotions accompanying this pandemic. On top of this, they have worries regarding the well-being, engagement, and performance of their teams. In a virtual world with less connection, it's hard for managers to help their employees and themselves stay well. It is important now more than ever that managers have the tools to recognize their own mental health and have strategies to stay well, to recognize when employees might be in distress, to have the difficult, empathetic conversations with their employees about their well-being, and to have ideas surrounding work adjustments that can keep employees at work. Keeping employees at work means that they continue to have a sense of meaning, contribution, routine, and connection with others, all factors that contribute to overall well-being. So sign up for our virtual manager mental health training that is now being offered virtually. You can sign up for one of our public sessions, the next one being on May 18th, or contact us to have a program customized for your team of managers. How do we take care of ourselves during this time of worry, uncertainty, and unpredictability to combat the crisis fatigue that we might be experiencing? Well, allow yourself to take a break. When we are constantly on, whether it be at work or caring for our families, we can easily forget that it's actually productive to have rest and to care for ourselves. We need to be filling our cups first so that we can be the best friend, parent, spouse, manager, employee that we can be. Disconnect from the media. Pandemic stress is often triggered or perpetuated by the bombarding we experience when we turn on the news, when we scroll through social media, or when we listen to the radio. The more we listen to or view media about the pandemic, the more we keep this stress response activated, and the chances of fatigue and burnout increase. Put down the phone, turn off the news, find other topics to discuss with your loved ones. Try and maintain a routine. Keeping a routine can reduce the impact of unpredictability on our stress response. The more we are able to anticipate, the less our mind is able to worry. Ask for help. As you've seen in this presentation, now more than ever, people are realizing the importance of mental health and well-being. Self-care looks like acknowledging that you are struggling and asking for help from your loved ones, from your manager, or from a professional. As we saw in the mental health continuum, there may come a time when you get to the point where you need a professional to help get you back to healthy. Talking to someone about unhelpful thoughts or difficult emotions can be helpful for putting perspective on negative thinking patterns, being able to rationalize, see different opinions, reminding you that thoughts are not facts. So as an occupational therapist, I work with individuals on balancing their unhelpful thoughts so that they can engage more effectively with their work and other activities that are meaningful. Trying a new hobby, ensuring that you're getting proper nutrition, and getting regular physical activity can all help us to stay mentally and physically well. The bottom line is that there is no single approach when it comes to coping with crisis fatigue. So seek assistance and support to help you find strategies that work for you. And when you find those strategies and these things that help you with your self-care, commit to it. Commit to your own resiliency and self-care. Even after this presentation, grab a piece of paper and write down one thing that you commit to doing to help your well-being and your resiliency. And when you build new habits, it's best to be specific, talking about when you will do it, for how long, how many times per week, who might you do it with. Connect with another habit. So this idea of habit stacking with things that you do regularly. So such as always going for a walk before you have lunch or practicing mindfulness after you brush your teeth. Always start slow or small and build up gradually. Be realistic about the goals you set for yourself. Write it down and measure it and celebrate. Reward yourself for caring for yourself. Another unfortunate statistic that we've seen over the course of pandemic is a rise in the risk of suicide. Data from Statistics Canada indicates that 2.5% of the population reported having suicidal thoughts pre-pandemic in 2019. CMHA's survey asked participants in May and October whether they've had thoughts of suicide. In the May survey, 6.4% answered yes. That increased to 10% in October 2020. If this survey were completed today, it's likely that this number would be larger, as we've seen in previous statistics. Suicide is a medical emergency that requires everyone to be diligent of steps to take when someone is at risk. If you know someone that is at immediate risk of self-harm, suicide, or hurting another person, ask the tough question. Ask them, are you considering suicide or dying by suicide? Sit with that person and listen to them without judgment. Call 911 or a local emergency number, or text TALK to 45645, where you can communicate with a trained crisis counselor. Always stay with that person until professional help arrives, getting their commitment to have professional help. And if there are weapons, medications, or other harmful objects, always trying to remove those from the environment. You'll see on the screen here a number for the Crisis Services Canada Suicide Prevention Hotline. There's also a number you can text. And it's also important, as I know that we probably have individuals from across Canada and maybe the world on this call today, is that it's important to know about your local crisis resources that are available in your region so that you can access support if you or if someone that you know might be at risk. Beyond those things that you can do to support your well-being, the well-being of your employees, and crisis intervention, at Gowan Consulting, we provide a wide variety of services to support mental health. We can provide mental health resiliency training to a group of employees, a group of managers. We can provide virtual occupational therapy sessions, again, drawing from those strategies of cognitive behavioral therapy, mindfulness, working on what work adjustments can help you to stay at work, working on communication skills and finding work-life balance, finding the tools to help you to stay well. We can complete accommodation assessments. So for those complex accommodation files where you need to take a look at the job demands and the abilities of an individual so that you can help to put in strategies to help keep them at work. And again, manager mental health training. If you'd like any additional information on any of our services or anything that I've discussed today in this presentation, contact Gowan Health at gowanhealth.com and we'll be able to provide you with more information. I just want to quickly leave you with the dates for our further Mindful May free training webinars coming up for the rest of May. So we have every Thursday at 12:30 different topics. And again, you can sign up at gowantraining.com/store. I want to say thank you for spending this time with me to talk about mental health and to recognize Mental Health Awareness Week and the importance of everyone caring for themselves and caring for those who are important to us.